Before I begin my presentation, I would like to show my respect and acknowledge the traditional custodians of this land, of elders past and present on which this event takes place. Furthermore, Aboriginal and Torres Strait Islander people should be aware that this presentation may contain images of people who have since passed away. In this presentation today, I aim to introduce you to the topic of lateral violence in Australian Indigenous communities, and to begin defining the role speech pathology has in assisting Indigenous members of the community to overcome the violence through the use of appropriate language and positive communication. It should provide speech pathologists with the initial information necessary for understanding and assessing Australian Aboriginal culture and language, and how these two factors are contributing to lateral violence. Approaches for intervention are also detailed. Ultimately, I hope this presentation will begin a conversation within the speech pathology discipline and expand the profession's perception about the role speech pathologists have working within diverse communities. What is lateral violence? Lateral violence develops when people who are victims of a situation of dominance turn on each other instead of confronting the system that oppresses them. A sense of powerlessness provokes a need to exert some form of control, and thus the oppressed become the oppressors. Lateral violence is brilliantly captured by the crab in the bucket metaphor. Individually, crabs can easily climb out of the bucket, but in a group they tear at each other in a useless competition which prevents any from escaping and ensures their collective demise. In human behaviour, members of a group will attempt to pull down, negate or diminish the importance of any member who achieves success beyond the others, out of jealousy, conspiracy or competitive feelings. Lateral violence is explicit in oral communication, including gossip, shaming, and blaming, as well as backstabbing, in attempts to socially isolate people. These behaviours mask feelings of anger and fear that can only be safely vented upon those closest. So where is the role for speech pathologists? I believe they can have a role in creating awareness as to how language helps fuel lateral violence, and assisting communities towards building strong relationships based on positive communication. This is achieved by educating Aboriginal clients on monitoring the effect of their language on themselves and others, assisting individuals to develop appropriate language for constructive communications, and facilitating an environment for effective communication and a voice for Aboriginal people. In order to achieve this, speech pathologists must be able to assess when a person is verbally degrading another, in turn requiring an understanding of Indigenous language and culture. Additionally, this will assist clinicians in developing cultural competence. Clinicians are required to acquire expertise to engage and work effectively in Indigenous contexts, incorporating the expectations of Indigenous Australian people, helping to build a positive professional rapport and relationship. What is the language of lateral violence in the Aboriginal community? Lateral violence is an emerging topic, so there is little relevant evidence base to inform practice. However, the topics listed here should equip speech pathologists with a basic insight into the forms of Aboriginal language, how language is used in a way that fuels lateral violence, and with additional insight into Aboriginal culture. This information will assist clinicians in making subjective assessment, which is culturally appropriate. Observations for assessment should be conducted in multiple environments, with recordings of communications in a naturalistic context taken and interpreters present if possible. Youth identify bullying of Aboriginality and identity as standing out above others as a means of creating issues of jealousy and victimisation within their communities. Identifying the presence of lateral violence requires speech pathologists to understand the language Indigenous people use to describe bullying. This information will also be valuable when asking clients to identify it in themselves and others. bullying itself is not widely used, let alone explicitly understood in Aboriginal communities. However, as a result of English language integration, there are common bullying phrases produced across Aboriginal and non-Aboriginal cultures. These include being picked on or picking on others. Additionally, being teased or hitting is also commonly reported. Other phrases such as "what's your go" and "let's go and fight" are widely understood as direct challenges. One term only used in Aboriginal communities is the phrase "carrying yerns." It was reported by a recent study to be used by 25% of Aboriginal children as a means of describing bullying. It should be noted that within the same study, children's depictions of interracial bullying from regional towns only recognise bullying in its physical forms. Speech pathologists, therefore, have a responsibility in educating people on the equally debilitating effects that verbal and covert bullying can create. Body language plays a major role in supplementing the language of Indigenous people, far more so than in non-Indigenous communities. Pragmatics and gesture are important in the context of lateral violence because, although subtle, they have the potential to create considerable tension and communication breakdown. Examples of lateral violence through gesture includes refusal to lower one's eyes as a show of respect to older people or persons in authority. Additionally, pointing with one's hand when giving directions is seen as disrespectful. Instead, they are often given through a pursing of the lips and a movement of the head. I have provided the following link for understanding other possible confrontational or negative hand signs, including hitting and no. Pragmatic examples that may contribute to lateral violence are disregarding silence. Silence or refusal to speak upon meeting is common. Not allowing for this could be interpreted as impolite. Direct and prolonged eye contact. This is considered intrusive, confrontational, and offensive and should be avoided. Instead, focusing slightly lower down the face, such as the lips, is suggested. Lack of engaging in body contact. Friendly touching of the upper torso and arm when greeting is common. Furthermore, direct questions are used less frequently in Indigenous communities. These are especially avoided in situations where personal information is to be revealed. Instead, information should be volunteered by both communicators, in a way hinting at what they are attempting to find out. To ensure culturally sensitive practice, speech pathologists themselves need to implement this culturally accepted body language when communicating with Indigenous individuals. Aboriginal English is a name given to dialects of English which are spoken by Aboriginal people and which differ from standard English in systematic ways. Aboriginal identity is upheld within Aboriginal English through the integration of accent, Aboriginal language vocabulary, and grammatical patterns transported from their Aboriginal languages. These include gesture, pragmatics, and the following linguistic features. The absence of the h sound. This is due to the fact that traditional Aboriginal languages do not possess the h sound. Additionally, f, th, and v are rarely present, rather b and p substitute f and v, and t and d are used instead of th. Therefore, saying "we had a fight" would be pronounced as "we had a bite." I have listed some others here which will be useful once you are working in the community for deciphering words. Without understanding of these basic linguistic features, speech pathologists are unlikely to decode the cruel messages being communicated. Therefore, they will be unable to assist people in developing more appropriate language, pragmatic skills, or gesture to alleviate the effect of the violence. Lastly, oppression. Two factors that have heavily attributed to Indigenous Australia's history of oppression are neglect and abuse. Learnt messages of oppression are passed down through generations, seeping into the belief systems. Language competence, in particular, is acquired in a similar way. Passed on by carer-child interactions. Communication, whether verbal or non-verbal, is the key to which relationships, positive or negative, are developed. Therefore, the consequences of child maltreatment in the form of neglect and abuse for this population are immense. In 2002 to 2003, 4,334 Indigenous children were confirmed as victims of maltreatment. This is 7 times the rate of non-Indigenous children. The impact upon speech pathology service is most evident as these children are likely to suffer poor educational and/or occupational achievement. Low educational attainment often means low health literacy, poor problem solving, and a poor sense of control and mastery over one's life circumstances. Linguistic competence is required to resolve many of the day-to-day challenges we face. It is required for verbal reasoning and the ability to effectively discuss or negotiate with others. Thus, the mastery of expressive and receptive vocabulary and sentence structure, turn-taking, topic management, and the ability to understand and use non-literal language is essential for confronting lateral violence. However, these skills are often lacking in Indigenous individuals. As communication experts, speech pathologists have an important set of skills to assist these individuals and families. I recognise that speech pathologists are already working hard in assisting these children in developing their speech and language in order to elevate them to the appropriate standard. However, now required is an effort of prevention in order to alter the life trajectories of future high-risk children. So how do speech pathologists implement effective intervention? Naming lateral violence is the first step towards exerting control over it. An awareness of individual and community contributions is necessary. Individuals need to develop a heightened sense of self by being consciously aware of the hurtful language they utilise. Speech Pathology Australia suggests a holistic, client-centred approach is necessary when working with Aboriginal communities. Decisions can then be inclusive and client priorities and concerns honoured. A service for learning and developing language skills is also necessary, providing the antidote to the verbal abuse. In doing so, clinicians must consider the presence of multilingualism. A preference to use one of the languages over the other is likely due to social or cultural influence. Additionally, speech pathologists should be aware that acquisition of morphological skills are at a slower rate than monolingual individuals. Next, individuals have to regain their voice. After years of neglect and abuse, this is likely to be a difficult and slow process. Time here is a crucial factor for speech pathology intervention. Initially, speech pathologists will have the responsibility of being their voice, advocating at all levels from government to the community on all issues affecting their quality of life. Lobbying for speech pathology input at the prevention table, at public debates and for health forums, having ongoing presence in the community, developing strong and professional relationships, and starting widespread conversation on the topic of lateral violence is an essential role. Speech pathologists also play a part in creating effective communication environments. In doing so, they must be mindful of cultural protocols such as men's and women's business. Some practices and customs can only be performed by men and women separately. In consideration of lateral violence, people may not be able to discuss their issues with the opposite gender if in conflict with the gender-governed rules, so other avenues must be considered. Canadian lateral violence advocates utilise workshops and discussion groups for intervention, creating a safe place for discussion and confrontation. However, it will be dependent on the community's desires and presentation, as each will be different. Support from Aboriginal elders and community members is therefore vital. Leaders within the community can not only guide clinicians on culturally and community accepted actions, but assist in motivating and engaging the community. I would like to thank you for taking the time to listen to this presentation. I hope I have deepened your understanding and you are now motivated about the role speech pathologists can have in addressing lateral violence. I have also left my references here for further information. Thank you.